Hello to all of you. I am Dr. Aparna Jaswal. I am a cardiologist, electrophysiologist at Fortis Escorts Heart Institute, Okhla, New Delhi. It is indeed a pleasure to be with all of you today, and we are here discussing something which is extremely important, and it is a discussion which must take place because this is a problem which actually all of us are vulnerable to. So, the topic of discussion today is sudden cardiac arrest. As cardiologists, we see that this is a topic which leaves many doctors also confused about what is sudden cardiac arrest. So, what to speak of the common public? As the name implies, sudden cardiac arrest is the problem which comes suddenly with the onset of symptoms, and we lose our life within 1 hour of onset of symptoms. It can either be a sudden cardiac arrest or a sudden cardiac death. Sudden cardiac arrest is something where either doctors or fellow people intervene and abort the episode, and the patient comes about and becomes alive again. And that is called sudden cardiac arrest. The other is called sudden cardiac death, wherein it is unfortunate, nobody intervenes, and we lose the patient. So we have to have a distinction, and we must make sure that each one of us works in the direction that we are able to save ourselves from the episode of sudden cardiac arrest. Second, we are trained well enough. Should this problem come to any one of our loved ones, we can take care of them. And third, we do everything humanly possible so we or our loved ones do not succumb to sudden cardiac death. At the very outset, it's important that we understand the distinction between sudden cardiac arrest and a heart attack. There always remains a confusion amongst people's minds as to what is a cardiac arrest and what is a heart attack. So, when we talk of a heart attack happens because there is a sudden blockage in the blood vessels of the heart, and the person can perceive and complains of sudden onset and tightness in the chest. The pain can be retrosternal, meaning right in the center of the chest, and it can go to the shoulders and can come to the jaws, can also go on the inner side of the arm, and that is what is called a heart attack. When any one of us or our loved ones has a heart attack, we rush to the hospital because we understand that we can lose our life. So, heart attack is a problem of the blood vessels of the heart. While the distinction has to be clear, sudden cardiac arrest is a problem of the electrical system of the heart. What happens in sudden cardiac arrest is the heart, which is supposed to beat in an organized manner at 60 to 100 times a minute, goes into a complete frenzy, and there is chaos. It beats very rapidly, as much as 250 to 350 beats a minute, and that is what is called ventricular tachycardia, or very abnormal rhythm. And when the rhythm becomes as abnormal as that, there is lack of blood supply to the brain. Because there is no blood supply to the brain, the person can be confused, can fall down, and subsequently succumb to what we call sudden cardiac arrest. So I think it's important that we take the questions and we begin the questions that I can see on the chat. And I want to start with the first question that I can see is how to manage sudden cardiac arrest. So if we look at management of sudden cardiac arrest, as I mentioned in the community, it is important that we take a leap forward and we try and go through a training program which is called a basic life support. The basic life support entails a cardiopulmonary resuscitation program. There are several companies which run this, and we should have it at school level, we should have it at college level, we should have in teaching institutions, we should have it in offices where we all are trained with cardiopulmonary resuscitation, and we train our youngsters, and that's a one way that we can manage sudden cardiac arrest outside of the hospital scenario. Somebody who's already had a sudden cardiac arrest and is at a risk of having sudden cardiac arrest again They must seek their cardiologists, and there are certain devices which can be implanted under the collarbone, and these devices can then protect our patients from sudden cardiac arrest. So I think that's how you manage it. The next question is, how can youngsters be careful to prevent sudden cardiac arrest? I think that is first and foremost and extremely important to be understood. Sudden cardiac arrest occurs in those of us who have risk factors to develop blockages in the blood vessels. So, those people who are hypertensive, who have diabetes, who are smokers, who have high cholesterols, are obese, follow sedentary lifestyle, or have a strong family history of heart disease are the individuals who are at risk of developing a disease in the blood vessels of the heart, which puts them at risk of sudden cardiac arrest. So, to answer the question of Mriganka Sen, is how can youngsters be careful? Well, we must inspire them to exercise well. We must tell them that they must protect themselves from lifestyle disorders such that they do not develop blockages in the blood vessels of the heart. As a result, they will not be at risk of developing sudden cardiac arrest. The next question is, what lifestyle changes should one take? As I just mentioned, sudden cardiac arrest is a situation which puts people at risk if they have hypertension, diabetes, smokers, obesity, sedentary lifestyle, bad cholesterols. So, if we work on these elements by doing regular exercise, taking care of our blood pressure, our blood sugar, making sure our cholesterols are fine, those of us who are beyond 35, at least once in 2 3 years, if you don't have any risk factors, putting yourself on a treadmill. If we did all of them, we could protect ourselves from sudden cardiac arrest. So there's a question that how can I know if someone is experiencing cardiac arrest, and what can we do if we notice that someone is experiencing it? So as I said, that how can you know if someone is experiencing? If you are, supposing you are walking in a mall and you see that somebody who's an adult has suddenly fainted, dropped onto the floor, the first thing you need to do is feel for the pulse. Now, these are the points that if you have taken a basic life support course or a cardiopulmonary resuscitation course, you can certainly intervene and save a life. So, that's the most important thing, that we must move forward, and each one of us should attempt to know how and what is cardiopulmonary resuscitation. If we do that, we will certainly be a great source of help to the community at large and will be able to protect some patients from having sudden cardiac arrest. So there's another question which comes, that what are the chances that age group under 40 can get sudden cardiac arrest? We have to understand that sudden cardiac arrest typically takes place in adults, it takes place in individuals who are beyond 35 years of age. A large number of sudden cardiac arrest happens in the elderly. However, those who are 35 and beyond, we are well aware, do succumb to sudden cardiac arrest. There are individuals even younger who can succumb to sudden cardiac arrest. One of the most latest and fresh in our memory is what happened during the Euro football. Those of you who were watching the Euro in 2020, the Denmark captain had a sudden cardiac arrest which was captured on the field. He was a very young and healthy guy. However, we have to understand that there are certain diseases like thickening of the heart muscle, which is called hypertrophic cardiomyopathy, which puts you at risk of sudden cardiac arrest. And those who are beyond 35 years of age and have the risk factors which I just outlined, hypertension, diabetes, smoking, dyslipidemia, sedentary lifestyle, or a strong family history, this subgroup is at risk even in younger age groups and must have themselves tested from time to time to keep themselves protected. So there's another question which is very interesting, is how can one strengthen cardiovascular health? So I think the heart is extremely forgiving. It allows you so much time to strengthen it. And what is it the time? Ever since we are born, we must encourage our children to engage in physical exercise. It's important to understand the utility of engaging in good game playing exercises, making sure the lifestyle of diet is very well maintained, understanding that salt and sugar and all things white like salt, sugar, maida, that is the regular flour that we use, butter, ghee, all things white should be rice, wheat should all be taken in smaller quantities. When you do all of this and you exercise well, you don't smoke, you take care of your blood pressure, you take care of your diabetes, that is how you strengthen your heart muscle. So this is a very interesting question. How can people with good workout regime still suffer sudden cardiac arrest? Yes, it's important to understand that there is nothing foolproof in this world. We have to understand that no matter what we do, all of us continue to remain at risk of having certain diseases. So, what's important to understand is if you are an adult, at some point in time, go ahead and get your tests done. You could be having a good workout regime, but you may still be having hypertension, you may be still having diabetes, you may have poor cholesterols. We have to understand that we should work on all our risk factors. If you have worked on all of your risk factors, by doing so, you minimize your risk of suffering a sudden cardiac arrest. To say that nothing will ever happen will be wrong, but as humans, we have to try to do everything that is humanly possible to minimize the risk of suffering a sudden cardiac arrest. So there's a question which comes that how to manage sudden cardiac arrest and what to do during a sudden cardiac arrest. So I think we should bring this up on another format and another opportunity when we come next time, wherein probably I can have a forum where I teach cardiopulmonary resuscitation. So what you can do, because the person who's asking is extremely eager, I think if you look into the courses, we must inspire our young to take up these courses of basic life support where we teach cardiopulmonary resuscitation. So we tell the people how to look for the carotid pulse. If you don't find the pulse, we have to immediately initiate chest compressions. Now, how are you supposed to do chest compressions? In how many times in a minute you're supposed to do chest compressions? And when do you have to wait to see if you have been able to revive a patient? All of that is taught in an extremely systematic manner by taking up the cardiopulmonary resuscitation courses, which should be mandatory, and all of us should inspire and should do them. So again, there's a question that I have a sedentary life ever since pandemic and work from home. I also recently recovered from COVID. How can I lessen my risks of a cardiac arrest and other heart problems? So I think it's important to understand that, well, many of us have started working from home in pandemic, but to say that I have a sedentary lifestyle because of pandemic may not be right. I think pandemic, if at all, has given us the time to invest on our health better. The travel time should be invested on your exercise regime. If you utilize your travel time on exercise, that's the best thing that you can do to lessen the risks of cardiac arrest. What should you do during a sudden cardiac arrest is important to understand that while you are trying to revive the patient, you should not waste a minute. You should immediately call for an ambulance. You should take your patient, your loved one, immediately into an emergency room because your patient may need what we call a therapy from a defibrillator, which is called cardioversion or defibrillation, which may not be available in the society. We are aware that very evolved societies, and you must have seen at airports, have something called AEDs, automated external defibrillators. They hang somewhere in the corridors when you reach the airports. So just like these AEDs, we should want to have these in our societies, in theaters that we go for watching movies, in malls. With the help of AEDs, we can certainly save lives. So I think this is a very important question. What measures do we take to prevent sudden cardiac arrest for those who have already suffered from it once? So I think this is something which is very, very important to understand. Anybody who has suffered a sudden cardiac arrest once should not be having to suffer a sudden cardiac arrest again and succumb to it. So most important is anybody who's had a sudden cardiac arrest must visit his doctor, further his cardiologist, and then an electrophysiologist. Today, we have very special devices which are called defibrillators. With the help of defibrillators, they are called implantable defibrillators. We implant them under the collarbone. These defibrillators, which are like a matchbox, smaller and thinner than a matchbox, we implant them under the collarbone. The procedure in itself would take about 45 minutes to an hour. It is done under local anesthesia. The patient stays in the hospital for about 48 hours after the procedure. It is done under local anesthesia in a simple manner. So anybody who has suffered a sudden cardiac arrest should be on very good medical management, must seek an opinion from his cardiologist about an implantable cardioverter defibrillator such that he can be protected should he suffer an episode again. It is a well known fact that anybody who suffers a sudden cardiac arrest has a liability of 20 to 30% in the coming year that he may have it again. So you must not sit back. You must approach your doctor, must seek treatment, and take the treatment with good medications and the implantation of these cardiac devices, which are truly a medical marvel. They have been around now for over 30 years. We do a significant number of these implantable cardioverter defibrillators across the country today, and they are simple devices. They protect us and they truly save a life. So, how are the survival rates for patients who have experienced heart attacks or have sudden cardiac arrest? So, I think this is very important. So, anybody who has a heart attack, means a blockage in the blood vessel of the heart, must reach a hospital, must seek the cardiologist's opinion. And if the angiogram reveals a blockage in the blood vessels, and if his cardiologists tell them that you must have them open, they must listen to the cardiologist and have the treatment that is being offered. As far as sudden cardiac arrest is concerned, we as cardiologists and electrophysiologists guide our patients that if you are at risk of sudden cardiac arrest, meaning thereby that you have significant disease of the heart, you have poor pumping, that is an ejection fraction on an echocardiogram. If it is lesser, if it is compromised, you will benefit from the implantation of these devices, what we call implantable cardioverter defibrillators. So there's a question which comes that can sudden cardiac arrest happen to youngsters? And if yes, what could we do to prevent it? So I just mentioned it that sudden cardiac arrest typically happens in adults. It generally happens in adults beyond 35 years of age. But we have noted that cardiac arrest can also happen in young, healthy individuals, healthy youngsters, as we have seen it happen in the example that I just quoted to you. We have had several footballers succumb on the field and they have been captured. So, why did it happen? It is noted that generally sudden cardiac arrest happens in 80 to 90% of the time because of a blockage in the blood vessels of the heart. However, in younger individuals, it can happen because they may have some genetic disorders. One of the common genetic disorder is called hypertrophic cardiomyopathy, wherein the heart muscle becomes thick. It is diagnosed on an echocardiogram. If you have a family history of hypertrophic cardiomyopathy, and if any of your family members have succumbed to hypertrophic cardiomyopathy, it is important that we seek treatment. We ask our cardiologist and the electrophysiologist if we need an implantable defibrillator. There are certain scoring systems. We utilize those scoring systems and see if our patient needs a defibrillator. We engage in a dialogue because we have to understand if we identify a patient, even amongst the young, that you are at risk of having a sudden cardiac arrest, we can prevent it by giving what we call implantable cardioverter defibrillators, and they, as I mentioned, are a medical marvel, and we must essentially do that. So we have to understand that sudden cardiac arrest is a problem of the electrical system of the heart, and it is a treatable condition. We must want to learn the take home message. We must want to learn that there what is cardiopulmonary resuscitation. We must want to do a basic life support course. By doing these, you can protect our life. We must make sure that we exercise well, and we must make sure that we look after our lifestyle disorders so that we can protect our patients and ourselves from the cardiac arrest. I think I will take the last question is because this is important that somebody's father has suffered sudden cardiac arrest and we are trying to take care, but can it happen again? Yes. So, as I mentioned, somebody who has a cardiac arrest has a 20 to 30% chance of having another episode in the next year. What you need to do is you need to seek your treatment from your cardiologist, further electrophysiologist, have an echocardiogram done. If the echocardiogram and the blood vessels tell us that your father is at a risk, we must essentially engage in the thought process of having an implantable cardioverter defibrillator fitted into the chest wall under the collarbone. It's a simple procedure, and the patients and these devices are battery operated. The patients feel very confident once this is done. It is as if the patient has an emergency room inside his chest wall. He can do all activities of daily living with the ICD implanted. There should be no fear about these devices because they are truly our friend and help save a life. I think at this, I would like to conclude, and I would like to thank each one of you to have participated and asked these questions. If there are any more, please seek to connect with me and I will be happy to answer. So thank you very much. Thanks once again.